It's a beautiful day in the neighborhood, a beautiful day to ask a gay doc with Desert Oasis Healthcare's Dr. Renzo Corzano. Hey, Renzo, how are ya?
Hey, John, how are you?
I'm doing okay. This time last year, we were doing all sorts of stuff about heat. It's a heat wave, and we're in the hot weather, and people know to be hydrated, and people know to stay in the shade, wear sunscreen, put on your floppy hats, people.
Yeah.
But today, we're going to talk about something that is chronic, 12 months a year, 365 days a year, and 24/7. What is
And
it?
I want to talk about diabetes. One of the main reasons why I think I want to talk about this is because I feel like education is lacking into what it actually means, how it can harm your body, and the kind of like the things you should be doing to treat it and also to prevent it.
Before you get into the diabetes,
Yeah,
what is pre-diabetes? Because I have a friend who has pre-diabetes.
exactly. Okay, so pre-diabetes is basically sugar amount less than a diabetic. And the way
Okay.
that what basically that means is when we talk about diabetes or pre-diabetes, we're talking about a number, a lab value called an A1C.
Mm-hmm.
That just means like the hemoglobin in your body, like it basically gets attacked by a lot of sugar and it basically becomes this like new molecule that we can measure. Okay.
Now, an A1C test is one that you cannot study for and you cannot cheat on.
Exactly, because an A1C is basically how much sugar has attached to your hemoglobin over a period of 3 months.
So, pre-diabetes is when people have this running average of blood glucose that is spiked above average, but not technically diabetes.
Anything less than what an A1C 6.4 would be, all the way to about like 5.7. That basically puts you in the pre-diabetic realm. And the way that we're actually treating pre-diabetes currently is mostly with lifestyle modifications, changing your diet, increasing your physical activity. And these changes have to be sustained, okay? And we are basically aiming for about like 3 to 10% loss of weight in order to prevent progression of prediabetes to diabetes. And
Now, should you be on Ozempic?
exactly for the prediabetes,
Yeah.
you wouldn't be able to get the Ozempic, right? You probably would be on something like Wegovy or the Zepbound, which are the injectables to lose weight. But again, like that, what that's going to basically do is make you lose weight, and that's how you're going to be able to reverse the prediabetes and other stuff. But you could do that, but those medications, they get approved like depending on whether or not you meet certain criteria.
Right. So just getting your A1C and following doctor's orders is probably the best thing to do. So once somebody is a pre-diabetic, you give them some lifestyle choices, maybe hook them up with a dietitian to be able to plan their meals so that they can do it naturally, because natural is always the best way.
Yes, it is. And once you do it naturally, you're able to sustain those changes. Once you become a diabetic, there are certain things that you have to add to your medical routine. Being a diabetic actually harms a lot of different organ systems. And the one thing that I want to start with is uncontrolled diabetes, okay, can actually lead to erectile dysfunction. And the way that this works is pretty much the damage that is done by diabetes is basically just due to an increased sugar load in the body. Okay, like sugar just has a way of harming things like small vessels, okay, and nerves long term. And that basically leads to, as a diabetic, you basically have to get your eyes checked, like your retina, every year, okay, because diabetes can basically create retinopathy, which can lead to blindness. So that's one added specialist that you would have to deal with when you have diabetes. The other thing is it can attack your heart. It can actually increase your risk of having a heart attack because it can actually worsen plaque formation. And that's one of the reasons why diabetics should also be on a statin, which helps to lower cholesterol levels. And if you cannot tolerate one, there's also injectables for cholesterol lowering benefits. Okay. The other thing that it can do is actually because your kidneys are basically just a bunch of small blood vessels, diabetes can harm kidney function. and it can lead to kidney disease. And if untreated, you can end up on dialysis. Okay. So to prevent that, we usually put people on something like an ACE inhibitor or another kind of medication to actually protect kidney function. And if they have high blood pressure, we can also lower that with that medication. Okay.
Now, we speak to a gay audience, and there are a lot of people that are HIV positive. If somebody is HIV positive and they are diagnosed with diabetes, what are the ramifications of those two chronic disease combos?
What a great question, John. So diabetes can also worsen neuropathy, right? Which is basically this decreased sensation like peripherally in our nerves, right? So oftentimes it presents with like feet neuropathy, right? So HIV is known for worsening those symptoms, and add diabetes on top of that, it basically can worsen it a lot quicker. There's a lot of other stuff coming out right now that basically HIV, even if controlled, can actually lead to like chronic inflammation in people. And now we're trying to recommend people to be on a statin if they have HIV as well to lower that risk. So imagine both of these things combined, then you have just worsening outcomes.
Do you think they'll ever cure diabetes? Seems like it's a real cash cow for big pharma with all of these specialists, with all of these drugs. It
Yes.
seems like it's a good refill business. Do you think they'll ever cure it?
Cure is an interesting question. I think we can definitely control it because I think once someone goes into that diabetic realm, I think it's really hard to basically lower that A1C to a level that is basically sustainable without any medication to keep it down there. And that actually involves a lot of different things. It could be like genetics, just bad luck, right? And the other thing too is like we wrongly assume that all diabetics, it's basically a disease from obesity. I have many patients who are not obese or even overweight who are diabetics. So just because you're lean and great doesn't mean that you're not at risk for diabetes or that you don't have diabetes.
Mary Tyler Moore.
Yeah, for sure. And the one thing I also want to kind of reiterate here is that, and this is happening a lot with some of my patients, is that people get placed on these diabetic medications. And I think it's a good idea to basically ahead of time figure out if those medications are going to be something that patients can afford long term. Because one of the worst things you can do is start somebody on this one brand new medication for diabetes, and then they find out 6 months later that it's going to end up costing like $2,000 to finish out that regimen. And that's not good because then people end up not taking it. They don't tell anybody, and their diabetes just gets out of control. There's a lot of medications out there to treat diabetes, to control cholesterol, to control blood pressure that is basically generic, and it should be very cheap.
I have a friend who's been diagnosed with prediabetes and they put him on metformin. That one doesn't have a lot of side effects, does it?
It does not. Everything I'm reading from credible journals, basically, they're pretty safe. Now, that's not to say that people are not going to have side effects to these medications, but it doesn't mean that they're super toxic. But with metformin, the one thing you really worry about is kidney function. So if it starts getting reduced, you really don't want to pump somebody full of metformin. Okay.
And they worry about the kidney function with PrEP and
Exactly.
HIV medications too. So it could be a double whammy.
I love it. I love how you're bringing it all full circle.
I listen to what you say, and I learn every time we talk, I learn something new. And full disclosure, I'm diabetic. So you will never see me in flip flops.
Oh my God.
I am such a klutz in flip flops. And I thought, you know what? I'm not going to lose toes because I'm wearing flip flops, but I will wear the water shoes into the pool
I love
and,
it.
and all around. I just can't. But yeah, there's a lot of strategies that people can use to be able to live long term with chronic disease. We know this from our friends who are long term survivors of HIV. And there are so many that you don't even know about who have had diabetes for as long as we've known them, and they're healthy as a horse. There are these little dots that you sometimes see on people's arms. Then they put their phone over it and they get their blood glucose on a like instant level.
Yeah, that's amazing. And that stuff is actually really good because a lot of the times patients come in and they go, "Oh my God, it's like a game. It's like all about my numbers," and they become more involved in their care that way. I think it's awesome. If you're a diabetic medication, okay, that's one. You should be on a statin, okay, to lower your cardiovascular risk. And 3, you should probably be on something like lisinopril, losartan, something that's going to actually protect your kidneys long term. And get your eyes checked every year, okay, and check your feet at least every 2 days, because if you have a injury there and you can't really feel anything, it can quickly become an ulcer and a whole mess. And also, diabetics tend to have decreased healing, and so that can also worsen healing.
Yeah, this is why I don't have tattoos or piercings, diabetes. If you have a question for Dr. Renzo Corzano, you can send it to lgbtqhealth@mydohc.com, and we'll be happy to get you some answers. And we do appreciate having you in the neighborhood, Dr. Corzano. We had the lowdown on diabetes in Ask a Gay Doc.
Thank you, John.